Hello again, everyone. Mark Hackel, Macomb County Executive. Deputy John Paul Rea. Just kind of give you an update what's going on with COVID. In particular, I think kind of conversation specific to the vaccination and the vaccine concerns that we're seeing. Again, no secret to anyone. I think we realize there's a limited number of doses available statewide, which then means obviously health departments are being strapped with the ability to try to figure out how do we get those out, the limited number we're given, to an incredible group of people that want them. So you got people that want them that are in various categories. As I said before, seniors should not have to compete for this right now, but apparently they are. It's almost as if there's this kind of self-preservation going on right now where people are just saying, hey, if I'm able to get one, I'm signing up. And the seniors are kind of being left behind. And it's a very difficult, challenging thing because we're hearing about that. So we're trying to figure out how do we get through that and maybe make some other arrangements down the road here, specific so seniors have an advantage in this process, because according to CDC guidelines, that's what the federal government is requiring. I don't, again, whether it's Dr. Fauci or even the Surgeon General, they're pushing this next wave to be 65 years of age and older, and still pushing further on out these other categories, which is I think what we should be doing here in the state, but it's very disjointed. You got Wayne County doing something, Detroit, Kent County, everybody's kind of all over the board because there's not a coordinated effort with this limited number that we're getting. So today was again, Tuesday 8:30, we opened up the phone lines as well as access to the website, and boy, what a challenging moment it was for a lot of people once again, wanting the limited number of doses we had.
Mark, I think challenging is the appropriate word, and I also think trying for our team, because we know that we have the system in place that when more doses become available, that we will be able to deploy them to the appropriate priority groups and everything. But as you said, that self-preservation mentality for the hundreds of thousands of calls and clicks that we're getting, individuals hitting redial all the time, individuals hitting refresh all the time. Yes, we want to provide a platform, an equitable platform for everyone to get those vaccines, but with limited supply, they go just like that, and that was the difficulty that we saw again this morning. Are we excited about the fact that we're going to be able to serve 4,600 people across our community? Absolutely, Mark, and again, continued glowing reviews at the Vaccine Central, what we're doing over there at the VCULin building with our health department, Andrew Cox and his team. It's a great opportunity for us to serve the public in that arena, but again, still stressing, not enough doses out there right now.
And I'm glad you brought that up, because that site is conducive to what we're dealing with right now, the number of vaccines. I mean, there's no problem there. People are getting in, they're getting out, and they're being taken care of. And I'm getting calls from people saying, hey, why don't you have another site over at this location, or how about you do a drive-through? The problem isn't trying to vaccinate the people. We're able to do that, and it's a coordinated effort, and it goes smooth, and we're getting great reviews from that. We can handle that, we can manage that. The problem is the number of doses, and for some reason that just still hasn't sunk in with the public yet, and they're wondering, well, then why would we have opened it? We don't have the answers to that question. You don't create a demand that you don't have the supply for, but that's what happens statewide. And so with that, our health department is going to continue to manage it. We're going to continue to ask for 50,000 doses every time we put in for it. That's usually on a Thursday we make that request. But only getting 4,900 doses puts us at a complete disadvantage trying to fulfill the request people have to want to get vaccinated. So again, it's not a matter of trying to get the message out for people to confer with their doctors to see if they should or want to get vaccinated. We know there's a number of people out there that want it, but I can't help but looking at the numbers that we're looking at right now, and the group that is severely disadvantaged in the ability are the ones that should have been focused on and 100% attention drawn to, and it was our senior population. It's with the data, it's with the science, it's with the numbers, it's all the experts are saying that should have been the next phase to go into. And we weren't even done, by the way, with the paramedics, and we weren't even done with some of these long-term care facilities. But now to put those 65-year-olds into this or older and then add to it these other categories, wow, them trying to get on the phone lines, they tend to sometimes give up. So we're going to try to figure out how do we carve out something specific for our seniors here in Macomb County, because I can't continue to watch that happen and them be at such a disadvantage. So we're working that process out right now internally to see how we can manage that. There are probably going to be some groups out there saying, no, all doses should just go for everybody. I'm not believing that. I think we need to figure out how do we take care of our seniors here in Macomb County. So, if people want to challenge us on that, I'll accept that. But the reality is that should have been the group that was targeted right now, and solely for that group but that's just not the case right now.
Mark, all throughout this pandemic, we focused on serving the vulnerable populations in the arenas that are of greatest impact, positive impact to our community. So whether it's some of the community-based services we've been able to deploy through MCA or our Office of Senior Services, these are things that targeted those groups using the data and science, as you said. Now with this vaccine rollout, again, you've talked about the whole notion of staying on message and how that message kind of hasn't been communicated the best as it's coming from the feds to the state down to here us at the local level. That has been a constant message that has been coming from you of focusing on those vulnerable populations, whether it's the seniors that we need to continually to care for and get these critical resources, whether it was the care packages, whether it was the meals at the onset of this thing. And I think that's what we're going to look at, not only trending towards, but more importantly, ensure that we continue to advocate for.
Yeah, and it'll come with some pushback. There'll be some people that are not happy about it, but the reality is, I think everybody realizes that's what should happen. And again, we're seeing the focus. Detroit is just 75 and older. They're working on, and then they started throwing in others as well as postal workers, which aren't really a defined class in this. So everybody's all over the map. The city of Detroit, Wayne County, Kent County. I don't care where you're at in the state. Everybody's kind of got their own thing going, and that shouldn't be happening. There should be a coordinated effort like we did with Phase 1A. It was very specific. Everybody understood what the message was. We were trying to figure out how do we deal with healthcare workers, and as well, those are licensed DMTs. We were given the responsibility to deal with licensed DMTs, working with the private and or public companies here in Macomb County. It was going well. We were vaccinating well. The hospitals were taking care of those workers that were in the healthcare industry. And then they had agreements with some of the pharmacies to go into the long-term care. We understood that. Everybody had no problem. There was no concern. But the minute the floodgates opened and we started going off message by not doing the next category after we finished that category, and then bringing in other classifications with senior citizens with an incredibly low number of doses statewide, and we knew that, boy, what a challenge. But we got to figure out how do we do something to make an adjustment, even though there's still going to be a limited supply, to take care of the seniors who, once again, as even JP had mentioned, and you hear all the time, are the most vulnerable according to the data and the science. So we're going to continue to work through this. In the meantime, today we also opened up that Macomb County Cares for Small Business. There's some grants available, and if you want to just kind of touch on that real quick and make sure people, if you know of any businesses out there that would qualify or fit within this, please let them know, or if you are in fact one of those businesses, specifically restaurants, bars, and even some of these, if you will, banquet centers here in Macomb County.
So Mark, today we open up the Michigan Survivability Grant Program. It's out of the $4.1 million allocation that the county will receive out of a $55 million pool that comes from the state of Michigan. All those grant applications, all the eligibility criteria available at macombgov.org. There's a big button that says Macomb County Cares for Small Business Grant Opportunities Available. You just click that link. It'll take you through not only the application page, the eligibility page, all the information you need, what resources you need to provide and integrate into these, and those grants are going to be available here over the next week here. Again, grant closes this Friday, close of business. We want to get you all in there. Again, macombgov.org, Macomb County Cares for Small Business. Click that link. You'll be able to get in there and put in your information. It's going to be a process where the state's going to screen those applications. They're going to hand them back over to us, and based on the eligibility, the criteria, those that have been impacted by those DHHS orders that we saw in November and December are kind of those preliminary ones, but at the same time, we want to open it up for all individuals that can make a case for how their business has been negatively impacted. And again, we're going to continue to advocate for more resources as we keep responding to this pandemic.
Yeah, and it includes gyms, rec centers, even movie theaters. So, if you know somebody or if you happen to own one of these type of facilities, please let them know to go ahead and go to macombgov.org and click on that icon that was just mentioned here, Macomb County Cares for Small Businesses. And just a point of note on that, if you've already gotten CARES funding to be supportive from some other pool of money that was out there, you still can qualify for this. So it's still available to you. It's additional monies to help you through it. And again, it's about those businesses that have really been impacted and are still closed or partially open. So please take a look at that, see if you meet the requirements, and then fill out that application, as JP mentioned, goes to the state, and then it'll come back our way so we can vet through that and try to get $4.1 million out the door to some of our small businesses here in Macomb County. So in the meantime, on behalf of JP, myself, and all of us here in Macomb County, I want to continue to remind you to keep you and your family safe.